Okay, Gene, so it sounds like that you're having reflux, which is where the acid comes back up from your stomach into your esophagus. It's giving you all the pain. I really don't think that we need to do any further testing. I want to put you on some medicine that will control those symptoms, and if it doesn't work, we might have to do another test, okay? So I'm going to put you on a medicine called Prevacid. Have you ever heard of that before?
I have. Now, how expensive is that?
Well, I'm glad you asked. I will check that out right now and tell you. It costs, you don't have any insurance at all?
Mm-mm.
For a month's supply is $154 of this medication. So it may be that you would do better with the over-the-counter Prilosec, and I can look that one up too, which should be cheaper than that. So the over-the-counter Prilosec is going to be, yeah, $21. So
That's
good, let's do that. Okay, so you take one every day. You have to be sure and take it on an empty stomach. Take it first thing in the morning, at least 30 minutes before you eat breakfast.
Okay.
Now, you are also on a couple of other medicines, right?
Mm-hmm.
You told me that you're on that antibiotic right now for the sinus infection.
Right.
And
cholesterol medicine.
And your cholesterol medicine, which is Zocor, right? So what I'm doing here is just checking to see if there's any problem with those drugs. And good. All three of these drugs we're talking about go together without any interaction, so you don't have to change the dose or anything like that.
Okay.
Okay.
And I have one more question. I'm taking hepatitis B shots for work, and I can't remember when I had my second one, so I need one more, and I don't know if it's due yet.
Do you think it's been more than 4 months?
I can't remember.
Probably has, it seems like to me.
It's been a while.
Okay. Let me see then what we do about that. So, if your hepatitis B right there, catch up, okay. The minimum between the second and the last shot is 8 weeks, and for teenagers, that would be you, let's see, okay, 4 to 6 months apart. Okay, what it says is that if you are beyond that we can either give you the third shot, but there's a chance you may not need it. The other option is to draw blood and see if the 2 shots that you got made you immune, because in a lot of people it will. You're going to have that test done after the 3rd shot anyway.
Okay.
Since you don't have insurance, I think what I'd recommend is let us go ahead and give you the 3rd shot. Even though you're late, there's no harm. Then we'll draw the test after that.
Okay.
Okay?
Sounds good.
Great.
Thank you. What were the main ways you used the PDA?
I used it to look up the dose of a medication for the patient's stomach problem. I used it to make sure that it was not going to adversely interact with other medicines that she was already taking. And then at the end, when she asked me about her vaccine, she was off the usual schedule for that, and I used it as a tool to help me know how I'm supposed to get her caught up.
Okay, and how did you access those?
On the PDA?
Yes.
There's a menu. You want to see this? There's a menu on this that has several things, and Hippocrates right here is the program that we use for all prescribing, and we wanted to put her on Prilosec, and she wanted to know what it would cost, and so there's a menu here of the different things that I can find out, and this says pricing. Whoops. I lost it there. Pricing, and it says 20 milligram pills for 28 of them is $21.34. You get 14 for $20 and 28 for $21. I don't know why that is. So that was the first thing that we looked at. Also, she is on 2 other medications at the same time, and so I run this thing that's called a multi-check, where I can ask it to look for several different medications at the same time and see if there's an interaction between them. So this is the antibiotic she was taking, and then this was, what was the other medicine she was taking? What was it?
Cholesterol.
Yeah, cholesterol medicine. And I put all 3 of them in that box at the top, and then just tell it to run, and it will say, in this case, no significant interactions are found for the selected drugs. So I know that I don't have to change the dose because of certain things that she's taking. And then finally, she asked me about her immunizations, and there's a program here that's called Shots. And it has a menu here for any vaccine that you want. Hers happened to be hepatitis B, but there's all the usual childhood and adult immunizations, and it can tell you what patients should not get it. And if they are behind on their series of immunizations, it will tell how to get them caught up in a safe way.
When did you start using a PDA system? How long have you been using one for?
Probably about 5 years.
And how helpful are they?
You know, we keep them in our pocket all the time. We use them, maybe not on every patient, but we use them many, many times a day, in the hospital and in the office. So it's gotten to be indispensable.
Technology.